All right. So again, talking about overall health of the shoulder. Get out of the way. Kidding. So one of the most important things we want to do, especially with a patient that's just coming in, whether it's post-op, whether it's some kind of strain, tear and rotator cuff, whatever it may be, we want to try to restore some range of motion. Okay. One of the ways we do it, one of the ways we start with patients is using a dowel. It doesn't have to be a dowel, we have it for convenience, but we're going to use this for today. Okay. We're going to work on some primary movements, some shoulder flexion, shoulder extension, shoulder external rotation, abduction, all that good stuff. Okay. So,
Flexion, real quick, sorry to interrupt, but can you explain between passive range of motion and active range of motion?
Yes, that's actually a good point. So we're starting with a dowel because it's more passive. There's still some active portion of it because it's never going to be unactive or inactive. So passive is important because we don't want those muscle inhibitors to be overactive because we won't get that range of motion that we want to try to elicit. So what we want to do is passively, we're going to have, let's say we're focusing on the right side right now. We're going to go into shoulder flexion. We're going to have the bottom hands, wherever, however, it depends on how long your arms are. I have pretty long arms. We're going to have the bottom hand down here, top hand up here. We're going to let the bottom hand dictate most of the motion, okay? So most of the force is coming through that bottom hand. Good. We're going to have the hand towards the top, kind of thumb up. So we have that slight external rotation, a little more space in that joint cavity. So again, here, that bottom hand is driving my right hand up, okay? And again, it's mostly passive because again, the left hand's in most of the work, but somewhat active as we get to that end range. You're gonna feel that kind of fight against it. That's okay, we wanna get to that point. So also just slight discomfort, okay? It shouldn't be a sharp pain. If it is, it's too much range of motion. And then we're gonna slowly allow that hand to control the arm down again, okay? So again, what I usually say is this left hand, or whatever hand it may be, the bottom hand, is kind of giving the other arm just a little ride, a little assistance, which is the passive. Now active, obviously, is active. Okay, we'll go over that a little later. So that was shoulder flexion with the dowel. Typically, with any of these, you want to try to hold it anywhere between 5-10 seconds at the top, and of course, control on the way down, again, with the hand at the bottom. Same thing with shoulder abduction. You want to make sure they're in good alignment as best they can. Okay, so with the hand here as well, still keeping the hand at the top, kind of thumb up. Want to try to retract the shoulder blade just ever so slightly so we get the shoulder back. Okay, and as we go ahead and push with the bottom hand, I'm going to go into shoulder abduction. Okay, and typically sometimes it's against the wall, and we try to have them trace their arm against the wall. That way it keeps them that good and true shoulder abduction rather than having conversation and falling forward. And now we're going to more of a scaption, which is something else. Okay, so there's a lot of cues that you can kind of give them. Again, about 5-10 seconds. Slowly control it down. Okay, shoulder abduction. Scaption, since I mentioned it. Scaption is just in between, about 45 degrees. So scaption is right in between the flexion and abduction. Again, another important range of motion to work on. Really get to the top. A little bit of overpressure is okay. Discomfort. So flexion, scaption, abduction. One of the fun ones patients dislike, but super important, is a little bit of external rotation. So with this one, you want to start with about hands about shoulder width apart, roughly. Okay, supinated grip, so palms up. So I'm gonna do is go ahead and grab it. Okay, I'm gonna focus on the right side first. What we're gonna do is again use that left hand to do most of the work. As the right side passively gets into external rotation, watching out for the elbow, not letting it abduct. Okay, just getting that rotation. And you gotta feel that stress in the external rotators, teres minor, and the infraspinatus. Okay. And again, at first, if it's new to them, it's foreign. You want to try to go just about 45 degrees. See how they tolerate that, and maybe less for them, and maybe just at that point. But try not to exceed that just yet. Try 45 degrees first. Try to hold 5-10 seconds. Okay. See how they respond the next visit. It's super important. If you do too much too soon, they're not gonna like you. They're gonna be a lot more pain than they should be. And that kind of is for anything that we do with shoulders. So it's a lot of wording, a lot of stuff going on, but super important to start with these guys. And that's just the tip of the iceberg.